Hello, my name is Shailja Shah, and I'm a gastroenterologist at UC San Diego and the VA San Diego. May is Asian Pacific American Heritage Month and is the perfect opportunity to celebrate the rich history and culture of Asian Americans and Pacific Islanders in the United States. It is also an important opportunity to raise awareness about diseases that disproportionately affect AAPIs, so we can take action to rectify these disparities. I'm grateful to the AGA for allowing me to highlight one disease in particular, gastric cancer. Globally, gastric cancer is the fifth most commonly diagnosed cancer and the fourth most common cause of cancer deaths. In the United States, gastric cancer is generally thought of as a rare cancer, but this is not the case in certain minority populations, particularly AAPIs. Among the age group generally considered for cancer screening, there is an up to 14-fold higher risk of non-cardiac gastric cancer in Asian Americans, depending on the country of origin, compared to non-Hispanic whites. In fact, the age-adjusted incidence of gastric cancer is markedly higher than esophageal cancer in each major AAPI ethnic group, and even exceeds that of colorectal cancer in certain groups, including Korean American men above the age of 50. Gastric cancer screening programs have existed for decades in Japan, Korea, and other high-incidence countries, and this has translated to substantial reductions in gastric cancer-related mortality, which is the direct result of earlier diagnosis and the opportunity for curative resection. Unfortunately, in the United States, gastric cancer is most often diagnosed in the more advanced stages when symptoms prompt diagnostic workup. Gastric cancer is among the top 5 causes of cancer incidence and mortality in several AAPI groups and accounts for up to 15% of their cancer deaths, compared to less than 2% of cancer deaths among non-Hispanic whites. This doesn't have to be. Ultimately, we need to push the research agenda, and we are fully capable of doing this. We need to push for the clinical trials evaluating screening versus no screening in AAPIs and other clearly high-risk groups. We also need to better understand drivers of gastric cancer risk in these populations. AAPIs represent over 30 different countries of origin with richly diverse cultural practices, dietary preferences, health behaviors, and lifestyles. And it's important for all of us as healthcare providers to take the time to explore these factors and consider individual risk. So as we celebrate Asian Pacific American Heritage Month and the growing racial and ethnic diversity of the United States, by promoting equity and inclusion, we must likewise ensure this applies to gastric cancer prevention and early detection efforts. Thank you again for this opportunity to commemorate Asian Pacific American Heritage Month by helping to raise awareness about gastric cancer disparity in the United States.